So hypoglycemia is a condition where the blood glucose levels or the blood sugar levels are lower than the normal glucose levels. Often related to people with diabetes, hypoglycemia occurs when the body is deprived of insulin hormone that converts the glucose into energy. Blood glucose levels are considered low when they drop below 70 milligrams per deciliter. A severe reduction in the blood sugar levels can be dangerous. So hypoglycemia can occur suddenly or gradually, depending upon the individual's condition, lifestyle, or some of the common symptoms can be listed like dizziness, restlessness, sweating, shakiness, discontinuation of good sleep at night, fatigue, tiredness. It could also mean confusion or difficulty in thinking clearly. It could be skin turning pale or tingling sensation of the skin and the nerves, excessive hunger, sudden nervousness or mood changes. All of these are the symptoms of hypoglycemia. People who are unaware of their hypoglycemic condition often fail to notice the symptoms and can faint due to severe drop in blood sugar levels, leading to experiencing a seizure or even going into a coma. Let's understand who are at risk of hypoglycemia. So hypoglycemic risk factors differ from individual to individual depending upon the type of diabetes, the age, and health conditions. Certain red flags for when an individual might be at risk are diabetic people more prone to hypoglycemia than others. Second is excessive dieting that could lead to a drop in the blood sugar levels. The third one could be too much of insulin in the body, say an overdose of insulin medication. The other one can be too many medications, whether they are diabetic drugs or other drugs, but too many medications in your body can cause hypoglycemia. Let's talk about the causes of hypoglycemia. So the causes can differ depending upon the triggers that have been making the changes in the hormone levels of a person's body. So number one could be blood sugar regulations. Food contains carbohydrates and the body breaks down these carbohydrates into glucose molecules, and insulin helps these glucose molecules enter through our bloodstream. It enters our cells of the bodies. Mismanagement of the food habits or body functioning can result in an imbalance of secretion of insulin levels and can cause hypoglycemic episodes. The other one could be insulin intake for diabetics. So people with diabetes manage their insulin levels with medicine, whether it's type 2 diabetics on oral hypoglycemic drugs or it is insulin shots being taken by type 1 diabetics. An imbalance in the insulin intake can cause hypoglycemia or hypoglycemic events. Another cause for hypoglycemia could be excessive alcohol consumption. So drinking too much of alcohol can block your liver and stop it from releasing the stored glucose in the bloodstream. This can inflict hypoglycemic episodes. Critical diseases like cancer, tumor, endocrine problems, insulinoma, etc. sometimes induce symptoms of hypoglycemia. Let's talk about how is hypoglycemia diagnosed. If one is experiencing symptoms of hypoglycemia, it is always best to get a hypoglycemic diagnosis. This can be done immediately by checking the blood sugar levels using a glucometer or visiting the doctor at the earliest. Physical examination by the doctor determines the symptoms of hypoglycemia because they take a hypoglycemic test immediately and monitor the sugar levels constantly for preventing any fatal or dangerous episodes. Studying the history of your disease by the doctor, by examining your dietary habits, your lifestyle habits, medical history, etc., to actually know the probable cause of diabetes is very, very important. So the doctor may recommend carrying a glucometer or a glucose sensor to study intervals of low blood sugar and understand the patterns. How is hypoglycemia treated? Hypoglycemic treatment is done on the understanding of whether a person is diabetic or not. It starts with controlling the ongoing drop in the blood sugar levels by consuming at least 15 grams of carbohydrates immediately. So controlling hypoglycemia by eating 15 grams of quick digestible carbohydrate could be by taking fruit juice, dried fruit, cookies, pretzels, toffee, etc. to control the ongoing hypoglycemia. Other ways in which hypoglycemia could be treated are by making certain dietary changes and by medications. So consuming food at regular intervals is one of the distinct measures to balance food sugar levels. Make sure that you eat a nutritive diet with the right balance of carbohydrates, proteins, and fats. The other way could be by using medications. So for diabetic patients, doctors recommend hypoglycemia medicine in the form of tablets and insulin shots to maintain the insulin levels for optimum production of glucose in the body. Let's understand how can hypoglycemia be prevented. So hypoglycemia prevention can be done in several ways. First is regular checking of the blood sugar levels. If you have had hypoglycemia in the past, then checking the blood glucose levels on regular intervals helps in saving from further occurrence. The second one could be snack smart. So eating a 6-meal diet and snacking at the right time to ensure that the blood glucose levels never drop below the normal is one of the ways it could be prevented. The other one can be exercise right. So indulging into the right kind of exercise and keeping yourself fueled with energy bars or sports drinks, etc., to save from hypoglycemia during the exercises is a must. So you have to understand the right kind of nutrition related to your exercise intensity and duration. The other one can be drafting your lifestyle. So maintaining a balanced and healthy lifestyle with proper meal and sleep timings to save from hypoglycemic episodes is a very good preventive technique.